Approach to tetanus. So first of all, what is tetanus? Tetanus is caused by exotoxin produced by Clostridium tetani, which is an anaerobic spore-bearing gram-positive bacteria, often found in soil, dust, or nails. The point of entry is through laceration or puncture wound. An example, this is a nail, and this is John. John didn't see the nail, and unfortunately, he stepped on the nail. Clinical features of tetanus. The incubation period is between 2 to 60 days, and usually less than 15 days. The prodrome symptoms include fever. Some patients may also complain of malaise. Some also complain of headache. And among initial symptoms may be sore throat. Some patients may also complain of pain or stiffness at the jaw, pain at abdomen, at the back, and some patients also complain of difficulty in swallowing. However, the classical symptoms for tetanus, first one is trismus or locked jaw. Another one is rhesus sardonicus, in which the patient have a green-like posture of hypotonic facial muscle. Another symptom is opisthotonus, which is an arc body with hyperextended neck. Spasms may also be the symptoms. First of all is reflex spasm, in which triggered by a movement, noise, or injection. Another spasm is spontaneous spasm, which itself may cause dysphagia or respiratory arrest. Autonomic dysfunction may also occur in the patient, in which patient may have arrhythmia or wide fluctuation in blood pressure. Investigation of tetanus. Usually the diagnosis is made based on clinical findings, and no specific lab test for tetanus. Therefore, clinical findings is important. Management of tetanus include general measures, antibiotics, antitoxin, control spasm, and control of autonomic dysfunction. The general measures include wound care and supportive care. For wound care, you need to clean the wound and dress it, and you should debride any necrotic or contaminated tissue. Supportive measures include doing ECG for the patient, maintain his or her hydration, and shield them from irritants. For antibiotics, these are the example: metronidazole, penicillin G, erythromycin, and tetracycline. The antibiotic of choice is metronidazole, in which you give intravenously 500 mg 8 hourly, and this should be given for duration of 7 to 10 days. Other antibiotic includes penicillin G, in which you give 2 to 4 million units intravenously 6 hourly, or erythromycin, in which you give 500 mg 4 times per day orally, or you can give tetracycline 500 mg 4 times per day orally. For antitoxin, you can give human tetanus immune globulin, and should give as soon as stenosis is suspected. This antitoxin works by neutralizing the free toxin, however it does not improve symptoms, and the dosage is intramuscular 3000 to 5000 units given at multiple sites. For control spasm, you should give diazepam, which is a drug of choice. The dosage is intravenous infusion of 0.05 to 0.2 mg per kilogram per hour, or intravenous slow bolus of 10 to 20 mg 3 hourly. Alternatively, you can give continuous infusion of lorazepam 0.1 to 2 mg per hour. Patients who have severe spasm or respiratory failure, you need to do endotracheal intubation with controlled ventilation. Other drug which can control spasm is magnesium sulfate, in which it can control spasm as well as autonomic dysfunction. The dosage is 5 gram intravenous infusion over 20 minutes, followed by 1 to 2.5 gram per hour titrated, and you need to keep the serum magnesium level at 2 to 4 millimole per liter. Patients with autonomic dysfunction, for example sympathetic overactivity, in which patients have hypertension, you can give alpha with beta blockers. If patient present with hypotension, you can give intravenous fluids or inotropes. And you can give atropine if parasympathetic predominates in the patient. Thank you.